Hi, today we're talking with Dr. Tom from NatroNet. Our topic today is osteoporosis. Now, this is typically a condition we associate with post-menopausal women. So, Dr. Tom, what really is happening here?
That's a great question, and osteoporosis is unfortunately a more and more common type problem that we usually only hear about in postmenopausal women because the way the Medical Society looks at it, it's a condition that really only starts to show up after menopause when a woman basically stops her menstrual cycle, and there's supposedly then starts to be bone loss. But the reality is osteoporosis is not a postmenopausal women type condition. We have to look at osteoporosis as a condition that starts when a woman, or a man for that aspect, reaches their peak bone mass. The peak bone mass is reached about age 30 in a woman and maybe 35 in a man, and from that point onward it is actually on a downward decline. So we, in fact, are waiting way too long to even attempt to diagnose the problem, and we should be looking at it much sooner. So our approach to that particular condition is to be wary of any woman or man for that matter. There's certainly a variety of different risk factors that are involved for which makes both men and women more susceptible, of which of course diet becomes critical. And one of the most important times for diet is going to be in the teen years when bone mass is being laid down. Level of activity is another type of thing. And so it's not just about taking a medication when you're postmenopausal, or for a man who may be in his 60s, because men definitely get this, because preventing a fracture is pretty critical, because unfortunately, statistically, a woman over 65 who has a bone fracture has a very high likelihood of having another fracture within 1 year, and that often is related to a common cause of death of women over 65. So we need to look at it totally differently, not just wait until you have a problem or you break a bone. And it's not just about, you should take some calcium and some vitamin D. There's many other things that need to be looked at, which is why we approach it differently than most doctors.
Okay, great. Thanks, Dr. Tom.
You're welcome.